Hi, good morning. I'm here to pass the meds. I'm Laura. I'm going to be your nurse today. So first things first, I'm going to come in. I'm going to do hand hygiene, which is very important. I'm going to check my MAR here. Oh, it looks like it's going to be a good day. Today is Friday, 9/12. Okay, looks like today is due. We've got Coumadin 5 milligrams at 9 a.m., Cardizem at 9 a.m., Wellbutrin, nope, that's not till later this afternoon. I'm off shift, and Tylenol. Looks like, okay, excellent. All right, so I'm going to begin my first check. Oh, I have my stethoscope on. So my first check is I'm going to get my Coumadin out. And they're packaged in 5 milligrams, and I have to give 15 milligrams. So 1, 2, 3. Let me get my cup. This is my first check here of Coumadin. Excellent. Okay. First check complete. Okay with Coumadin. Then I'm going to get, I have Cardizem, 180 milligrams. So Cardizem. Awesome. 180 milligrams. Perfect. Check. First check on my Cardizem. And then I'm going to check, oh, I got to get my Tylenol too. Tylenol. Tylenol, 325. Oh, okay. Yes. Yes, perfect. Tylenol, 325, but I need 650, so 325. First check, I'm going to use 2 of those. Okay, so first check done. Second check, I guess I will check against the MAR again here as I take them out of my packaging. And I got Coumadin, 5 milligrams. 1, 2, 3. Okay, Coumadin for my patient Annie Ma. Okay, that's my second check. My second check on my Cardizem is 180 milligrams here. Check, put it in my little bin. All right, Tylenol, 650 milligrams. I need 2 of those. 325 a piece. What I injected and where I injected. Okay, good. Okay. And one more check. I want to make sure I got them all in here. So I've got 3. 1, 2. I got my 3 Coumadin for 15 milligrams. And I want to make sure I got it Friday morning. Yes. Got the right day. I've got my Cardizem, 180 milligrams. And then I've got my Tylenol, 650. Good. Okay, so that's my third check against my MAR. I'm going to put my Tylenol right here. I'm going to lock this baby up. Oh yeah, excellent. I'm going to lock it up, and then I'm going to go to my drug guide. Kind of make sure I've got this appropriate drugs. And I'm looking up Coumadin, warfarin. Okay, yes. Okay, Coumadin is high risk, bleeding, any sort of fall, making sure they're not, I gotta check diet. So that's a high risk medication. Okay, Cardizem, definitely for hypertension. Love me a little Cardizem. Okay, so I better check her apical pulse for 60 seconds. Okay, excellent. Making sure that the blood pressure and the heart rate are appropriate. And Tylenol, making sure I give the right appropriate dose, and that could be for bleeding and or any sort of allergic reaction. Okay, we'll double check that. Excellent. So I checked my guide. I have my medications. I have my MAR. I am going to wash my hands again because who knows who was touching that drug book. Oof. Okay, I got my medications. I have my MAR. Knock, knock. Hi, I'm Laura. I'm one of the nurses here today. How are you doing, Annie? Good. Okay, I'm going to make sure to shut the curtain. And what I'm going to do is set this down, open my MAR, and I'm going to cross-check my patient's band with, what's your name again? What's your first and last name?
Annie.
Annie Ma. Okay, so nice to meet you. And what's your birth date?
7/22/84.
Okay, great. I'm going to double cross-check that with my MAR. I'm going to set this here. And I'm going to, once again, sanitize my hands. Hi, I'm going to administer some PO meds today. The first thing I got to do is I got to take some vital signs and make sure that I can give you your medication. How are you feeling today? I heard you were in a little bit of pain on a scale of 0 to 10. I mean, the worst pain you've ever had in your life. How are you feeling?
About a 2.
A 2. Oh, okay, well, we're going to try and fix that right up. Okay, so I got the blood pressure going. I'm going to listen to your apical pulse, which is the pulse from your heart. So I'm going to get in here, and I'm going to listen for 60 seconds. Okay, wonderful. Excellent, excellent. Okay, I'm going to cross-check that with your radial pulse. Okay, good, good, good. Okay, looks like everything is where it needs to be. We are in line. It's above 60 for your cardizem. Do you have any questions on the medications that I'm giving you? So I have one for your blood pressure, and I have one to thin your blood to make sure that you don't have any clotting. Maybe you have AFib. I'm not sure what's going on. I would have looked at that. And then we've got some Tylenol for your pain, and I'm sure that that will make you feel better. How does that sound? Oh, good. Excellent, good. Okay. So I've got my meds here, and I'm going to sit you up in bed a little bit. I'm going to raise the bed to my height, and I'm going to put you forward so you don't choke. Excellent. Okay. So I'm going to administer each medication individually. So first I'm going to have you have your Tylenol. I'm going to watch you. Make sure here's some water. Delicious. Okay, excellent. And I've got the cardizem, 15 milligrams. Okay, and then I've got the cardizem was 180 and the Coumadin was 15 milligrams. Okay, perfect. All right. So now that I watched you have those, how do you feel? Good. Good. And I guess so. I'm going to lower the head of the bed. I'm going to go down a little bit. Da, 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 da. And then I'm going to do some hand hygiene. I'm going to grab my MAR. Okay, my name is Laura. If you need anything else, please don't hesitate to ask. I have the call bell light there for you, and the TV changer is right there. Okay, and I'm going to take off your cuff here. You probably don't need this. And, okay, so I'm going to come out. I'm going to shut the door for privacy, and I'm going to document the 5 R's, right patient, right route, right time, right site, right medication, and I'm going to initial every medication to make sure that the next person knows that I did it. And all right, great. It's a great day.